if there are issues around guardianship or power of attorney or some other things along that, who has guardianship, which parent does, or some kids in situations that they're in foster care or adoption settings, that there may be some different processes involved because of that. But generally, with that being said, my facility, Horsham Clinic, and our sister facility, Brookland, also has adolescent inpatient. We have 2 dedicated units to adolescent, which is generally 12 to 17. And we also have a children's unit, which is the only one in Montgomery County, which is ages 4. I know that sometimes that sounds hard to take in, but 4 crises do happen at that age range, to 11 or 12, depending on the maturity level. And that is a dedicated unit specifically for those age range. All 3 of our inpatient, units are not school-based, but do have teachers assigned to them. All of our consumers or patients get time direct with teachers. We try to make sure that all of our patients are able to keep up with their school level, so when they reacclimate to the community, that it's an easier transition to return to. It's obviously difficult to be separated from family. There are situations where family doesn't want to be separated. I know I have twin 9-year-olds, and I have a 13-year-old, and I know what that would be like. We do try to involve family as much as humanly possible in the treatment team process, and how to keep everybody involved, and visitation and everything like that. For our inpatient level of care or our partial level of care, we also have a partial program. We have 3 of them, actually. 1 in Montgomery County, 1 in Delaware County, 1 in Chester County, which are for school-age children. Again, broken up in age groups 4 to 11, 12 to 17, which is a lower level of care than the inpatient, that you get to go to the programming during the day, meet with the psychiatrist, have group and individual therapy, and then get to be home at the end of the day. It's a fairly intensive program. It is 5 days a week. A lot of the school districts in Montgomery County and in Delaware County do offer transport to the various locations. So there is either school bus or van transport to our programs. Typically, to get into any of our programs, there is some level of assessment that's needed to be done, that can sometimes be generated out in the community with an outpatient provider. Sometimes that comes from a hospital emergency room, or sometimes you can call directly. We have Horsham Clinic does have an assessment center. You can call us to ask in advance if your child is in need of this. You think your child is in need of this level of care. We do assessments. We do ask that you call in advance to our assessment center, just to make sure that we have the availability. During the school year, there are high demands for our adolescent and our child units. We do get referrals from pretty much everywhere in the eastern side of the state for those units, because that resource is so limited. In addition to our child and our adolescent units, we do have adults and dual programs. Altogether, the Horsham Clinic has 10 inpatient units. We're on 55 acres. It's a former farm. It's really very pretty grounds. I hope you don't ever have to come up there, but if you do, it is a very nice place to be able to connect with. And in our partial programs, we have adult and adolescent located on our Montgomery County grounds. In Delaware County, it's located in Broomall, and in Chester County, it's outside of Coatesville. I don't want to, if you have specific questions, I'll be happy to answer around any of those particular topics, or how to access that, or general questions about Montgomery County. I'm also happy to answer if you have anything specific.
Thank you. That was good pinch hitting.
I'll leave my contact information in the chat. I know, if anybody has any questions or needs to help navigating the system, I'm happy to help. You can email me. I'll leave my cell phone number in there as well. Text, phone calls. If I don't answer right away, it's probably because I'm on the phone with somebody else. So, I'm happy to help however I can.
Thank you.
Ingrid, just one comment. I'm probably stating the obvious, but for families who this is the first time that a child is having an issue, I think it's really important to let them know that there's a difference between treatments between childhood, adolescents, and adults. So just because sometimes people just don't know that.
Okay, thank you.
There are also a variety of other levels of care. I mean, we provide at the Horsham Clinic, we provide inpatient and partial hospital, but there are things called like IOP, which is an intensive outpatient. There are other levels of care like residential treatment facilities, which is sort of like one of the earlier Amanda spoke on CRPs. It's sort of crisis residential program that's sort of like that, where it's structured and residential. There's outpatient where somebody comes in weekly. So there's a variety of different types of programs. And it can be very complicated and very difficult, especially if this is your first contact with the system, with the mental health system, which on a good day is overwhelming. And I certainly understand that. I get calls from families all the time. This is the first time I'm going through this. How do I get from point A to point B? What do you think given this situation? And like I said, I'm happy to answer those questions, even if even if Horsham Clinic is not the answer and something else might be more appropriate. I'm always happy to kind of steer you in the right direction and connect you to where the right place might be.
And I'm going to show you our resources for youth. So I'm going to share my screen. So this shows you our resources for youth, which is on our website. And I am going to scroll down. So mental health conditions seen in childhood, and a screening tool for, does my child have a mental health condition? And mental health books for children and teens and their parents. So this is a resource for you. And resources for helping children, teens succeed in school. Okay. So, Karen, are you ready to roll?
Oh, sure.
Okay.
Okay. I already put my my information in the chat, and I put 2 websites in the chat as well. So my name is Karen Irwin. I am from the Greystone Program at Friends Hospital in Philadelphia. Greystone is a residential program, and Friends Hospital is an inpatient psychiatric hospital. And even though we're on the same campus, under the same umbrella company, they're completely separate programs, completely different levels of care. So I have found over the years of working at Greystone and taking calls for folks that are seeking residential services, there's no one size fits all answer to everyone. There's so many factors that go into finding a residential program for someone. It just takes a lot of telephone calls and advocacy and just trying to find the right fit for someone. And that's really what it's about for us at Greystone. And I would say at any residential program, you want to find a fit for the program itself and for the individual seeking the services and their families. So that's, bottom line is I don't have, specific answers, but hopefully I can give you some things to consider as you're seeking residential services. And most important to that is, what is the individual willing to do? What are they voluntary to do? All residential services, well, I shouldn't say all, most residential services have to be completely voluntary. There are a few places that, it's an involuntary situation. I'm not going to talk about that. Really don't know that much about it. And those are kind of extreme places, not many around here for adults. But that's another topic. Since we didn't really get a full discussion on services for youth, I will just say that I'm going to be talking about adult residential services, but there's a whole slew of residential services for youth. And for the most part, those are covered by Medicaid up to age 21. So there's a lot of resources for that. For youth that are seeking residential services, that said, there's always wait lists and, it's hard to find places. And again, you're looking for a fit. So I would, the website, the NAMI website is great for getting you started on looking for residential services for youth. So as I said, there's a lot of factors that go into looking for a residential program. Are you looking for something that's short-term, something that's long-term? Are you looking for a younger person, an older person? Are you hoping that Medicaid can cover this, or commercial insurance, or private pay? All those factors are at play when you're, when you start your search for residential. And as I said, I've taken hundreds of calls over the years for people that are calling Greystone, and it's not a right fit for a variety of reasons, as I've mentioned. And then I try to direct them to services that they can look at in their search, because I can't hang up the phone without trying to help them in one way or another. So if it's not for Greystone, I'm going to try to point them in the right direction. And that's some of the stuff I'm going to share with you today. So I will say that one of the first places I tell people to look at, and I should clarify, I get calls from all over the country, because Greystone isn't just for folks in this area. Though, by and large, if there's family involved, you want to be fairly close to the residential person where your loved one may be living. One of the first places I tell people to look is your website. The NAMI mainline website is fabulous for the explanation you have about residential services and how to look for residential services. So I've been giving that website out to a lot of people over the years. So thank you for doing that. It's really, and it's not just for residential services, but for the topics that you have, which you can, see earlier that were discussed from the website. It really is a fabulous website. And I work with a lot of different NAMIs, Philadelphia, Montgomery, and beyond, because I've been an advocate for NAMI for many, many years. So, kudos to you for the website that you have and the resources that you share. One of the first places I tell people to go is to their local county mental health office, whatever it might be called, Department of Behavioral Health, Office of Mental Health, whatever it might be called, and find, it might take, a few phone calls to get to a person who can actually tell you what housing and residential services they offer for individuals that have mental health issues. Because most counties do have, they recognize they have to have some sort of services for those kinds of housing supports and things like that. So various community mental health centers may offer services in that area, residential and housing. And that's usually it's overseen by the county mental health office, whatever that's called in your county. So they're usually, if you get to the right person, they can be a wealth of information, or if they have it on their website, they'll be cautious. It could be old information. So, again, I'm an advocate for phone calls, because then you're getting the latest the latest stuff. So that's really one of the first places I tell people to go to see what's even available in your county. Because when it comes down to it, residential services have to be paid for one way or another. And there's a fair amount of good options if you're trying to get things covered by Medicaid. Again, that'll go through your county office. There's a lot of options if you have the money to pay for a private pay program. And just like so many things in life, there's not a lot of options for in between. So there's been many times when I've spoken to families and, really talk about the benefit of getting someone on disability or SSI to be able to have Medicaid, because there are more resources for Medicaid that make it affordable for families. So the other resource that I put in the chat already is the American Residential Treatment Association website. And that's known as ARTA. ARTA is the abbreviation, and then their website is www.artausa.org. And the reason I send people to that resource for residential services is because that's what they do. They are a group of about 30 plus residential organizations around the country, and that's strictly what they do. It's a difficult vetting process to get into the organization. So that the organizations in there, have gone through that rigorous process to be part of the organization. But even above that, they have fantastic information on that website about various residential topics. So why look for residential, finding the right facility, what's a good fit or a good match. So that's a great website. One of the other things they do is, and they list obviously all their members, but one of the other things they do is they classify residential services into 4 categories. And I think it's really useful to discuss these 4 categories when you're considering residential care, because it applies to, residential programs outside of ARTA as well. And those categories are the types of residential programs: farm-based. So that's when, it's on a farm and there's various work that's related to the farm, and that's what the participants and the residents do. There is apartment-based, and that is when there's generally the organization has a number of apartments that they manage and multiple residents live in there, but the organization that manages it, provide other services as well to help the person stay in the community in the residential setting. There's the third category is clinical, and this is for a residential program that is, has a stepped up bunch of services that are more clinically related. They might have DBT, they might have psychopharmacology, genetic stuff. They might have a variety of things, but it's much more, there'll be groups where there's various topics, psychotherapy, process psychotherapy, things like that. So that's a clinical setting. And then the 4th setting is a group setting. Excuse me. And the Greystone is considered a group setting. And so you don't see the kind of clinical stuff that you see in a clinical program. Like I said, the process therapy. We are at Greystone, and I think the majority of other programs that fall into the category of group are based more on improving functioning. It's not a group home. I'm going to make that distinction for sure, because group homes have a negative connotation. There's a lot of services that go along with it, but just not that high level clinical. So we focus on functioning, improving functioning, activities of daily living, and really maximizing the potential of folks. Because, for some people, residential might be they might make a residential program their home for a number of years. For other people, a good chunk of folks, they're really looking to build up their independent living skills so they could potentially be on their own or be in whatever kind of situation they came from, go back to that safely, or potentially to be independent living for their first time. And, programs like ours assist people with that as well. So the problem with most of the ARDA organizations is that they're private pay. Now, I spoke earlier about lots of options for Medicaid. Yes, there's lots of options for private pay residential programs. And I would say, in the ARDA world, and frankly, in residential programs all around, you will, they could run from $6,000 a month to $36,000 a month. I don't know about you, but I can't afford that for myself. Either one of those numbers if I had to go into a program like that. But there certainly are people that do. And they're great programs, great services. But that's just a distinction that I want to make clear on the private pay versus the Medicaid piece. One caveat I just want to say before I go into more detail about Greystone and programs like it. This is kind of like a caution warning. So residential services in the substance use world have been around for a long time. It's on the newer side for mental health residential programs to a certain extent. But the reason I'm mentioning it is because many substance use disorder programs have built up their mental health residential set of services, which is great. But some of them are still focus a lot on substance use. So if you have someone who's strictly mental health, no substance use co-occurring, and they get into one of those programs, they may not be happy with the amount of substance use disorder therapy that goes on as well. So and frankly, for all the calls that I get over these years, it's one of the most common complaints that I've gotten, that someone will try a residential program that may be at an organization that's been doing residential substance use for years, and they built a mental health one, but it's just not enough mental health treatment. It's still focusing too much. So because I get that statement so often, I did want to say that. Part of the problem there is terminology. In the substance use disorder world, they use the word inpatient and residential almost interchangeably. In mental health, those two things are very different levels. So people get confused with the numbers, with the names, with the terminology. So I would just throw that out there to be cautious as you're seeking residential services, just to be really, and this is true regardless of the substance use issue, you really have to research any place that you're going to consider, whether it's, looking at their reviews, what you can do on the website, talking to staff at the program about what they do. You can even check the health department records about the organization, just to know as much as you can, because again, going to that thing I said in the very beginning, a fit is the most important thing you're trying to do. Am I freezing? I see can you hear me okay? Okay, good.
Yeah.
I see the little blue circle going around in circles. That's never a good thing. As I said earlier, and I was touched on earlier, that going to the county for services often can enlighten you about all the range of things. We talked about one of the things that counties make is the crisis residential programs, which was touched on earlier. That's an option within the county. And again, here we're talking mostly Medicaid, possibly. Sometimes, well, generally not Medicare. Medicare generally does not pay for residential, hardly at all, though I'll give you one caveat later when I talk about some local places. And a lot of the local community mental health centers have housing supports and residential services. So whatever's in your area, for example, Horizon House, Irwin, Holcomb. Trying to think what else is in the Paul, help me if there's one in Montgomery County that's specifically housing. The various, is there one, Paul? I'll let you.
For adults, I can't think of any of
Okay.
the child.
Yeah, but many programs, many community mental health centers that have a full service range of services, they also have housing supports.
RHD, that was it.
You
Sorry.
thought of one?
RHD. They
RHD,
do
thank you. And sometimes they run their own group homes. And again, I use that, don't want to use that connotation in a negative way, because they have these homes that they set up and they have staff supporting them. So that's a great way, especially if you have Medicaid. And if you can get your loved one to be involved in that, in a local community mental health center that has housing supports, that's a wonderful option to be able to get into a residential program. Probably the best, if you're fortunate enough to be near one of those agencies that offer the housing supports. And then also check your insurance company. This is a little bit complicated too, in the sense that if you're looking for short-term residential care and you have commercial insurance, the individual has commercial insurance, always check with them to see what's in network. Because now, and again, it's a fairly recent thing, some insurance companies will pay for mental health residential services. Usually it's short term, 30 days, maybe 6 weeks, something like that. But when parity came through a number of years ago for mental health and substance use, they're supposed to be offering it. So sometimes you have to advocate very strongly to get an insurance company to pay for mental health residential, but they're supposed to be doing it. I'll leave it there. They're supposed to be doing it. It's a law with parity. So if there is commercial insurance involved, it's always worth finding out what they cover, what's in network, or how their out of network stuff works. And there's a number of residential programs for mental health that are covered by commercial insurance. So that's if you're talking commercial, that's where you want to go to first. And then, as I mentioned, the private pay programs, and you'll see a lot of them in ARDA, as I mentioned, though I will also say some of the ARDA programs do work with insurance. One of the local ones, New Vitae Wellness and Recovery, actually somehow works with, because you get other services that are covered by Medicare, it brings the monthly rate down to a certain extent. So I don't want to really go into how that works exactly, but that's always a phone call worth making if the person has Medicare. And then some of the ARDA places, and like I said, some of these can be 24. I think there's one that's $40,000 a month. So not a whole heck of a lot of people can afford that, but some of them do offer scholarships and other ways to make it affordable for people to go into residential care. And I'm saying all the bad stuff that's related to money, but I will say some of these programs are amazing with what they offer, what they can do, and how they work with folks. Some of them are very specific, and this is another great thing about the ARDA website. Not only can you filter by the type of program of those 4 things I talked about, and you can filter by location, but by seeing the descriptions of all the programs that are part of ARDA, you can see some of their specialties. So for example, there's programs that are strictly for younger men that have both mental health and substance use. There's programs for, I think there's one of the programs for women that have borderline personality disorder. So if you have a very specific need for the loved one that you're looking for residential care, you could potentially find it on there. And that's worth so much to find something that's that specific. So that's another reason I send people there, especially if you're looking for something that you can't get anywhere else. Let me talk a little bit about Greystone, because I will mention the other ones in our area, but I think there's a lot of similarity between them. And because I know about Greystone, I'll tell you a little about Greystone in more detail. So as I said, we're more about improving functioning, activities of daily living, with the goals of getting people to do as much as they can on their own. We know empowerment is so important with what people do. We try to build socialization, really get our folks engaged and live their life to the maximum quality of life. So at Greystone, and I will tell you, Greystone, there's a little bit of a mainline connection in that. So the Greystone House is on the grounds of Friends Hospital, which many of you may know has been around for over 2 centuries, providing inpatient mental health care for all that time. In the early 1900s, they built the Greystone House. And that was where now keep in mind, they did things a lot differently then, but what we now call the medical director would live on the grounds of the hospital, and they would live in Greystone House with their family or whatever. So Greystone itself is a house. The Greystone program consists of two houses, however, the one I just described called Greystone and the other one called Hillside House. They built that, I think, in the mid 80s. And we use Hillside, which has a chairlift to get to the second floor. Greystone, I can tell you, over 100 years old, you have to walk up the stairs. That's the only way you're getting around in the Greystone House. But one of the medical directors that lived there in the early 80s said, he had a young family. He's like, I want to go live out on the main line. And then let's make the Greystone House just for folks that have, need a place to stay, supportive and secure, that could really benefit from utilizing the house. And that's how Greystone was born in the early 80s. That was also, around the time of deinstitutionalization, when they tried to get as many people out of the hospital, but there was still, a lot of people still needed that extra support. And that's how Greystone was born, and has been operating since then. I think we're at, I'm not sure the exact number. I want to say 38 years old there at Greystone. And as I said, we function on improving, we specialize in improving people's functioning. So the staff will do whatever they need to do for folks, but we want folks to do as much as they can for themselves. So what that looks like very specifically, we expect our residents to participate in the various activities of daily living in the house, just like you and I do in our own homes. When it comes to meals, if all somebody can do is put napkins out, that's great. But for other people, we want them to help plan. We want them to help cook. We want them to shop, whatever those skills are to improve where they're at. That's what we want them to do. And the staff will work for people to get that improvement. Socialization is a big piece of what we do as well. We address that through both our daily, we do have 2 groups in the day. So both through that and through various activities, both on-site and off-site. Medication compliance is another big thing that's an issue for many of our folks. So if all somebody needs us to do is hold their meds, that's great. That's all we'll do. But other people need a variety of behavioral interventions and reminders and motivation to help keep them medication compliant. So those are just a few examples of what we're doing to help our folks gain independence and functioning. As I said earlier, for some of the folks, we're doing very specific things to help them get to become into some sort of independent living situation, whether that is, actually helping them find the home or learning how to take the bus or money management and things like that. So it really depends on what the person's goals are as what we're addressing. And I find at Greystone, and I think this is probably similar to some of the other places I'm going to mention, we find our folks come in kind of 3 categories. Some folks do choose to make Greystone their home, and they may be with us for many, many years, if not decades. Some folks come to us more for like a 6 to 12 month kind of stay. And that might be for folks that just need to build up those independent living skills. And then the other category is our respite option. And that people do respite for a variety of reasons. Sometimes it's just, there may be something going on in the family and they, want their loved one to stay for a short term at a residential program. Sometimes it's just to build up additional stability after someone has a hospitalization. And there's, like I say, there's a variety of reasons that might happen. We used to say that our respite option was 3 months. We have lessened that a little bit. It could be like 2 months, but we don't want to make it too short of a time because this is a residence. This is where someone lives. So we don't want to have too many people coming and going. So those kind of are where our options are. And we have and you'll find this varies a little bit between the various residential programs in our area. We happen to have a lot of psychiatric time. So our doctor, who happens to be also a doctor at Friends Hospital, she splits her time between the two facilities. Technically, she's there a total of the equivalent of 2 days, but she actually spreads it over 5 days. So there's a lot of, first of all, that's a lot of psychiatric time for a residential program. And plus, because we have our staff 24/7 that are monitoring our residents, there's a great feedback loop between our residential counselors and the psychiatrist, so that the psychiatrist knows exactly what's going on in detail. It's almost, and that feedback loop is really what helps us catch people from potentially decompensating. One thing that is very different from Greystone than other places is the fact that it is on the grounds of Friends Hospital. So in the fortunately rare case where someone does need to step up to a higher level of care, we have that continuity of care, including with the same doctor. Like I said, fortunately, it's rare that that has to happen, and that was something that surprised me when I first started. I thought there'd be more, more kind of the times when people decompensate just because of cyclical nature of things, but they do a really great job with that. Another thing that they are really great at is helping engage people. So a lot of times it might be what the family wants. Yes, the potential resident might be agreeable, but for a variety of reasons, it might be hard for them to engage with the program and be successful at it. But our staff is really good at trying to engage people. We really try to get a family atmosphere. So people are not just improving for themselves, but for everybody in the house. And I'm going to get off the topic of Greystone, but before I do, I'll just say our costs, so you know, are daily, $235 a day for a shared room and $250 for a private room. That comes out to be about $7,000 a month for a shared room, about $7,500 for a private room. And that includes all room and board, all the 24/7 staffing, the psychiatrist. The only things it doesn't include are and again, this is similar to all the other places I'm about to mention in our area. It doesn't include medication, which goes through someone insurance. And then generally families do have their loved ones have like a small monthly amount that they can use for souvenirs when we go on an outing, or special, personal items, shampoo, or things like that. So it's a small monthly amount on top of, the amount that goes into the actual program. So the other programs that are similar in our area are I mentioned New Tay Wellness and Recovery. That's technically Bucks County, but some of their programs are in Lehigh as well, I think. And they have both a small homes where they have a small number of residents, and they also have a large residence, like 100-something people in there. And so they have both aspects of that, depending on what the individual needs. There is in Bucks County, and they're also in Philly, is Project Transition. As I mentioned earlier, that's an apartment-based program. They're definitely Bucks County and Philly. I think they might have something in Montgomery County too. I'm not sure, but I don't think they go beyond that. And in Chester County, there's something called Spirit of Geel. That's G-H-E-E-L, by the way. They're very similar to Greystone in both the folks, the ages of folks that we have. And one thing I didn't say about Greystone, and I'll say it during Spirit of Geel, we do kind of specialize in middle age and older adults. That's something that not a lot of programs do. Our average age at Greystone is actually 62. Most of the people that come to us are in the 40 to 60 range. And you'll see that, a lot of times it'll be a family who may have been taking care of their loved one with mental illness for most of their lives, in one way or another supporting them. And then the parents realize they're getting older and they, need to come up with a longer term plan. So very often we get folks in their, late 50s, sometimes even in the 60s that come to us. Spirit of Gill is like that as well. Another one, and this is fairly new, it's in Delaware County, is Clark's Manor. It's part of Irwin. I don't know if you've heard of that, but that's on a beautiful, it's a beautiful old home that a family donated to make this program around their loved one named Clark, who had dealt with mental illness for his life. And he actually lives there as well. So that's I would say that's the newest thing around. Who did I miss? Project Transition, New Vitae, Spirit of Gill, Clark's Manor. And I did just hear, as I said, Clark's Manor is part of Irwin. And I did just see in either Facebook or on the news somewhere that they're considering making a residence just for young adults, which I think is a fabulous idea, very much needed. But each of the programs have something that kind of sets them apart. So part of the duty I would say that a family has as they advocate and look for residential services is really see what is it about a particular program that sets them apart. You know, for us at Friends, first of all, the older adult piece sets us apart. But also we're on, you know, even though we're on like 100 acres in the middle of Philadelphia, we're still in the middle of Philadelphia. So if you have someone who's going to want, you know, more of a rural feel, well, a rural setting, I should say, then you're not going to get that at Greystone, even though at Greystone we have 100 acres and walking trails and things like that. If we have gardens, we have things like that. But if that's not what's going to fit your person, then you want to look at another option. And some of the so bottom line is, and I keep saying, you kind of do your homework about various places. Some other options, and I definitely am going over my time, I apologize. One thing to keep in mind, I mentioned the community mental health centers that have housing supports. There may be residency issues of where someone can go based on where they're from. I always say, you know, there's a way to keep people in the home as well sometimes, to build some wraparound services. That could include like either case management through a local community mental health center, or even private case management, or even home care. I guess what I'm saying there, you know, whatever the family pieces that the family can put together to help someone stay in a residential setting, whether it's independent or in a group setting, sometimes you kind of have to think out of the box to put all that together. And I will end just with a personal story. So my sister-in-law has an uncle with schizophrenia, and his parents, he's now in his late 50s. His parents pretty much took care of him his whole life in one way or another, whether he lived with them. And, you know, it worked out pretty well. There were a couple rocky times throughout his lifetime, but his parents were getting older, and they were, not just they, but the rest of the family were concerned about how he was going to do once the parents passed. And just recently, the last of his father had died a few years ago. His mother just recently died. And fortunately, the family had really educated themselves about services. He ended up getting into supportive subsidized housing with some of these wraparound things that I was talking about, including going to a program that supports him as well in the house. Very strong family support and advocacy, including NAMI. This is in another state, by the way, not Pennsylvania. And his one sister really educated herself about all the services in the area, going to their local NAMI, and put all those things together. And this man is thriving. So I always want to say, never forget the great amount of potential that folks have, how important family is to putting all those pieces together. Obviously, love being a big part of that, and just really think outside the box and try to get folks in the place that's going to help them the best. And then because I get so many of these phone calls, I also want to just put myself out there to you. Anybody can call me anytime. I put my telephone number and my email in the chat. As I said, talk with hundreds of people, trying to put some of the, with a little bit of with about 10 pieces of information, I can kind of point you in a direction that might work for you. So I'm always happy to take a phone call and brainstorm with families. So, you know, I'm putting myself out there to each and every one of you, and whoever hears me remotely, please feel free. Karen Irwin, 215-384-8215. And that's the end of my presentation, but I will just say for anyone who's interested, speaking of NAMI, so Friends Hospital is actually hosting NAMI Philadelphia's walk next Saturday, October 7th. It's actually at Friends Hospital. And like I said, Friends Hospital is a 100-acre campus. We actually connect to the Philadelphia Park System. So the 5K walk will go on both parts of it. So I'm a big fan of NAMI Mainline's walk, and I've been happy to sponsor there for many years. And I don't know if you're walking this year, but if you don't want to walk in Philadelphia, please feel free to come to our campus next Saturday. And you guys know how to get to the NAMI Walks website.
Yeah.
Thanks for this opportunity to be able to
Thank
talk.
you.
Take any
Thank you.
questions.
And Judy, you have your hand up.
I do. Karen, thank you so much. I am so impressed with your holistic approach about treatment. When you said a rural environment or a city environment, that means so very much. Being here in Colorado, it is so different than being back home in Philadelphia. And people don't think about that. So
No.
I was impressed with that. And I think it's so important. So thank you for being holistic in your approach.
It's very important to do that. As I said, you know, you're not going to have the success you can if you're at a place that you're not comfortable with or doesn't fit what your life is about. So yes, thank you for recognizing that.
And any other questions for anybody? Thank you, Karen and Paul and Amanda, who couldn't maintain her internet connection. And I will see you all in hopefully the next time that we have a program.
Thank you.
Bye.
Thank you. Bye.
Thank you very much. Bye-bye.
Thank you, everybody.
Thank you. Bye-bye.